Now, COVID-19, we initially saw the first patients with this in March of 2020. At the time, it appeared to be very much like a painful bladder, but over time, we have noticed more and more patients with basically, first of all, urinary frequency. So they're passing urine very, very frequently. They also get pain if they do not pass urine, or they can also get urgency. So they feel a desperate need to pass urine. Another key part of what's now known as COVID bladder is that they will wake at night to pass urine. And the patients often will have a history. So people will say, oh yes, I, for example, would only get a urine infection maybe just twice a year. And then suddenly they're having continual infections. And the same will happen with sometimes somebody may put the key in the door when they've been out and they arrive home, they put a key in the door, they get a feeling that they need to get to pass urine. But since COVID, and often people will date it to either around February, March of 2020 or December, January of 2020-21, that they now put the key in the door, and if they don't get to the toilet, they will actually leak. And they will quite often leak before they get to the toilet. Associated with that are long COVID symptoms. And these include fatigue, intolerance to foods. So foods such as pineapple, kiwi, strawberries, chili, interestingly, white wine, sparkling wine, because of the sulfite content. The person may well get rashes, swelling without any reason. If the person had irritable bowel, the symptoms of constipation or diarrhea get worse. And also, they may notice that when they stand, that they feel dizzy, and that their heart beats very, very fast. And there is very important data on this to show that there are certainly abnormalities of certain white blood cells, which are called T cells, which seem to decline in people who have long COVID. And we certainly have looked in the bladder, and we find those cells living in the bladder. So the reason why on the blood tests there seem to be less of these cells is that they're going into the tissues, causing inflammation, making everything very irritated. And the interesting thing about these, that when people are treated with this, there is a study by Glynn et al., which was just published 3 weeks ago in October, that these patients actually respond to type 1 and type 2 antihistamines. And in this particular study, they used loratadine and famotidine. But also, we have found that something called mast cell stabilizers work very well. So it's not just that the person's bladder gets better, but all their symptoms improve. And certainly in that study, they found that after 1 month, 73% of patients had their symptoms improve. Another thing which people find quite distressing with this is they'll often feel very anxious, and there are over 59% of patients with long COVID in the study by Glynn actually were found to have symptoms such as anxiety and depression. So it affects all parts of the body. We see lots and lots of inflammation, strange things, but people can normally tell us exactly when it occurs. And the other important thing is that the patients who have this, generally COVID was actually very mild. So they're not patients who went to hospital and were very ill. They are people who may often have noticed in the family other people having COVID, and they themselves didn't get COVID at all. But they may have had maybe just a slight headache or slight sore throat, if it was the Delta variant, or if it was the original variant, they may have had a slight cough, but the symptoms were not severe. But then a month later, these other symptoms start to appear. And it does seem to be something to do with the immune system. The key thing about these symptoms is that, first of all, what has happened is that doctors who've been investigating have been either lung doctors or doctors who deal with blood pressure. So each individual area, we have doctors who deal with different parts of the body. And it's only when we look at the areas which are affected, on one hand, there are the lung symptoms, so problems where people find it difficult to breathe when they walk up the stairs. So patients will talk about, whereas before they would be able to walk all the way up the stairs, they suddenly can only walk up 3 or 4 steps, and then they're breathless. And interestingly, when patients have had a histamine type 2 blocker, and we know that there are histamine type 2 receptors in the lungs, they suddenly find within 2 weeks that they're able to walk up the stairs normally. And quite often when these patients are investigated, people say, oh, we can't find anything wrong with your lungs. We don't know why you can't take a breath. In terms of things like the heart, often people will have something called POTS, which is postural orthostatic tachycardia syndrome. So the person feels very dizzy when they stand, and their heart beats fast to try and keep the blood pressure up. And again, this is both the lungs and the heart are related to something called the autonomic nervous system. And this part of the nervous system gets involved when people have infections. So for example, if somebody has really bad flu, and all of us have had this, you should, in theory, have thought, I should be able to sit at my desk and write or do some simple task. But people will actually say, I just feel so ill, I've got to go to bed. Now, the reason they have to go to bed is because their blood pressure is low, the pulse is high, and they have to, by lying down, the blood pressure corrects, and therefore they feel better. And people will often say, oh, I stood up and I felt really dizzy, I had to go straight back to bed. So this is a normal response to infection, be it viral, bacterial, that the body does these things to the blood pressure, breathing. People will often find they will get a bowel upset when they have an infection. And so, of course, we see this strange irritable bowel-like response. So all of these are responses of the immune system to an infection. But what's interesting about COVID is that it makes one part of the immune system very angry. And it's called the innate immune system. And it's part of the immune system that we see with, for example, if somebody has a mosquito bite, the bite itself, nothing much happens. But 24 hours later, we see swelling, redness, pain. So not surprisingly, and this is where the innate immune system has become very angry. We see a similar thing with patients with long COVID, that they will complain of muscle and joint pains. So it's often classified as fibromyalgia, which means that there is pain in different parts of the body in at least 18 sites. And this is, it's almost like the body is having a large mosquito bite, really. So it's painful, they feel swollen. People often talk about also feeling toxic. They feel like they're almost being poisoned. But of course, this is the body trying to fight something which may not even be there anymore. So quite often, we expect certainly that even where somebody has a severe COVID infection, that after 14 days, the COVID will have been cleared from the body, or certainly the person is not infectious. If they're less severely infected, then it will be 10 days. But the key thing is that the body still thinks that the virus is present, and therefore these symptoms continue. I think one of the key questions when a patient has this is, what can they do? Certainly, there are long COVID clinics where patients can be assessed. One of the key things which I've certainly seen when we're treating patients' bladders is that patients will often have a low-grade bladder infection. And so what has happened is that the body has decided that there is the virus in the body. The body has then produced inflammation. The inflammation has affected the inside of the bladder. And we've now looked at over 60 patients with this, and we find that the inside of the bladder, when it is filled, starts to bleed because it is very, very inflamed. And when we biopsy, we find lots of inflammatory cells in the wall of the bladder. When the wall of the bladder becomes very inflamed, the lining becomes very fragile. Now, we keep bacteria out primarily through the skin. So, for example, inside the bladder, there will be a lining, and it keeps the bacteria away from the body. But if the bladder becomes inflamed, that skin layer breaks down. And therefore, first of all, the immune system can see what is in the urine. And especially as it will be angry, it will be looking for bacteria. So even a low level of bacteria can get very angry. The second thing is that because the lining of the bladder has become disrupted, instead of being a smooth surface which bacteria can no longer attach to and they get flushed away, they start to live in the crevices inside the bladder. So we end up with a very long-term infection. And what we've been surprised by is that the type of bacteria which we're now finding post-COVID are completely different from the bacteria we found before COVID. So before COVID, about 4% of patients would have Klebsiella. If we were looking at an elderly care home, it would have been about 11%. We now find that it's 60 to 70% of patients will have Klebsiella. So a completely different organism, because the environment in the bladder has become completely different. And quite often patients will complain of not only the frequency, urgency, waking up at night, but they will also complain of pain in the kidney. So it's a very, and these patients are truly distressed by this. This is life-changing level of symptoms and tremendous fatigue. So that is quite important. The treatment with a patient who has COVID is normally very acute, involving painkillers and treatments to try and reduce temperature. And usually patients will be assessed as to whether, for example, if they had a chest infection after COVID, was it bacterial or was it a leftover of the viral infection? Patients also will complain of diarrhea or bowel upset. And again, the same should be checked for. But the long COVID symptoms are present for 12 weeks after the initial infection. So they are not just that the acute infection, this is something which has got a different aspect to it. And the treatment is very different. We are trying to calm down. We're not treating a virus or the effects of the virus acutely. Here we are trying to calm a part of the immune system which has become angry. So we're trying to calm that down. So the treatment is very different. I think one of the crucial things in terms of long COVID, and obviously I can only base my advice on the patients that I've seen, and the majority of the patients that I will have seen have had bladder problems, and then I happen to notice that they have other symptoms throughout their body. And we do find that with treatment, all the other symptoms do resolve. I think one of the crucial things is that certainly vigorous exercise or trying to almost beat the long COVID does not work. People end up much worse. If you think about it, if you were recovering after flu, nobody would say, well, you ought to train for a marathon now. That's the best way of recovering from flu. So why, it's the wrong way of thinking about it. This is the immune system thinking that there's a viral infection still present. And obviously the important things are, it is important to exclude other infections. Just as we've seen in the bladder, bacterial infections occurring after the COVID. I've heard about patients having chest infections or bowel infections. So other infections occur. Or for example, with the bowel, where somebody is suffering from constipation and diarrhea, which commonly happens after with long COVID, it's important to make sure that the bowels are working normally, because unless the body, all the problems are corrected, the immune system is not going to stop. Its job is to protect at all costs. So it thinks there's something wrong, it carries on. So it is treatment over a longer period of time. As I said, from this study by Glynn, it appears that certainly antihistamines like loratadine, which is actually available over the counter, did help. And 73% of their patients, after a month, found that their symptoms had settled. Now, additionally, they did also prescribe famotidine. And then there are other medications, which are called mast cell stabilizers, which we also give. But it is a complicated problem where the treatment has to be directed to the areas which the patient has problems. As I said, the patients did not have no symptoms prior to COVID. They will have had something. They would have had either recurrent bladder infections beforehand, or they may have had irritable bowel beforehand. There would have been other problems. Then the COVID comes, it switches on the immune system, and the immune system remembers that there were these other problems before COVID, and that's where it goes. So it's important to deal with the immune system, but also to deal with perhaps the original problem. So certainly we found with our patients with recurrent bladder infections, for example, we have to suppress the infection to allow the immune system to calm down, because the immune system is never going to stop if there's an ongoing infection. Its job is to protect. And it's almost like having a bodyguard who has gone out of control. The bodyguard has to feel safe that there's no reason to start attacking. And only then do we find these symptoms settle. And what is amazing is that we are seeing the majority of our patients getting better and going back to normal.